Today, we are fortunate to be able to have both Cynthia Schneiderman Miller and Tiffany Johnson here as our presenters today to talk to us about health equity and digital literacy. I'm looking forward to hearing from both of them. Cynthia, did you want to do a brief introduction for yourself?
Yeah, Cynthia Scheidemann Miller. I've been involved in telehealth since the mid-90s and have enjoyed working with them and through its growing up from being a toddler. We're getting closer to more of a teenager stage now. And I've been many facets that I've worked with. I've been in the university, I've worked with healthcare systems. Recently, I was the administrative director of a large hospital system with a lot of clinics. And then with COVID, all of us got a new experience in rolling out en masse to a lot of people at once in the home for telehealth. So it has been quite a ride, but it's been very interesting and we've learned a lot.
Thank you, Cynthia. And Tiffany.
Hi, everyone. My name is Tiffany. My background is in public health by training. I've been working with these lovely consultants for coming up on 2 years now. And so a lot of what I bring to the table here is a public health perspective. I'm pretty active in American Public Health Association, and I've also worked in a few academic centers doing some public health and epidemiology research now. I'm also a first-year medical student.
That's right. We're all very proud of Tiffany. She has been an intern for us and a consultant, and now is in medical school. So thank you so much for bringing your expertise in public health to this presentation. Today, we are going to talk about a variety of different areas around health equity and digital literacy. So I'll let you all kick it off.
So I'll start. If we want the patient to really attain their full health potential, which is the goal of health equity, then we need to start where the patient is at. They may be very comfortable with technology, have done telehealth, no problem, or it may be totally new to them. And if it is, then we need to address any concerns that they have. One of the first questions is always, will my insurance pay for this? You know, we all ask that. So one of the tips that we did at different clinics was to actually create a summary chart for the clinic staff by payer, if they paid for telehealth or not. And then with now we have more people using audio only. So we had to incorporate that into the chart, and it has to be updated periodically, but that's a great way if the patient is concerned about it, you have the answer right there. We actually had one nurse that was very creative, and she knew the doctor that she worked with liked to follow up visits over telehealth when possible. So she had a brightly covered note card that even said that, you know, telehealth was paid by the payer for this patient. And so the doctor could very quickly say, oh, we'll do a follow-up visit over telehealth. How comfortable are you with telehealth? And so that was very creative on her part. Another concern that patients sometimes talk about is security and their health information. You know, it's just because it's a telehealth visit, you still have to follow HIPAA, and we reassure people that it is very protected. Sometimes their concern is just simply that they're outside their comfort zone. They don't want to look foolish or do something wrong or break something. You know, I might break the computer, or I might do something with my cell phone that you know, I have bad connotations. And so you just have to work with them. It's okay. Everybody's the first time on telehealth. You know, we'll walk you through it, whatever reassurance you can give them. And then sometimes it's something, a concern is something that you hadn't even thought of. So you need to ask about it. We had one patient in a home health situation that had the technology, was comfortable with it. And then a family member said, oh, you know, Nurse Nancy, the home health nurse, is never going to come again if you have that technology. Well, the patient was appalled. They'd love Nurse Nancy to come, and we had to do some education and reassurance that no, Nurse Nancy was still coming to the house. But in between times, this gave them a chance to connect and to if the patient had any questions, then they could contact Nurse Nancy. And so then it worked out very well. But it was just a concern that we hadn't considered, and had we not dug a little deeper, we wouldn't have found out why they didn't want to have technology. But again, like I said, it became a good experience. And you also need to treat telehealth as a standard of care, that it is equal. If the provider could get the adequate information to make a diagnosis, then it can be equal care. Sometimes even arguably, sometimes people say it's better, but we'll go with equal. And I had a behavioral health patient recently that, why I'm thinking about this. I had a behavioral health patient recently tell me that they were late getting to getting home. They were out and about, late getting home, so they didn't make their telehealth visit. Well, they expected the provider to contact them and find out why and reschedule, but the provider never did. So the patient got the unspoken message that telehealth was not equal or wasn't important to the provider. And he said, well, if the provider doesn't care, I don't care. Mm-hmm. So I just as a hint or a suggestion, I would try to make sure that if they don't make a telehealth visit, that somebody follows up with them. Even if it's just, did you have trouble with the technology? Did something come up? Whatever it is. And then that signals to them that yes, this is an actual visit. The provider set aside time to talk to you. It is important. It's one of those, it's an unspoken thing, but it does relay that it is important. And then again, encourage the patient to ask questions before the visit, during the visit, whatever. Make sure that they understand this is a conversation. It's not just one-sided.
I think it's really important what you just said, Cynthia, because this idea that it's the same workflow as when you would have an in-person visit. If you would have called, if a patient missed a visit, then you do the same with a telehealth visit. That sets up a standard, and that's true for everything. Same with consent, same with patient has the ability to say, I don't want to do a telehealth visit. Any of those things to add that comfort to the patient. I think that's a really important point. I would also add around privacy. A lot of times we're now having to ask, and I would encourage folks to put that into their workflows, to ask the patient, are you in a private area? And so they can verbally respond to you, yes, I'm in a private area. And maybe it's not private enough for you, but they think it's private enough. But it is at that point a private area. And the same is true for the provider, that they be, and often organizations are putting standards around that. You need to be in a private space with a door, et cetera, to be able to conduct the visit. I'm going to go to the next slide.
Yeah.
So the provider input is incredibly important when it comes to ensuring a consistent message is being sent to the patient. There are patients that are apprehensive about telehealth, and their first virtual interaction will really influence their future feelings about utilizing virtual care. And if patients detect an attitude of frustration or feel like that personal connection isn't fostered virtually, it may deter them from future use. Opposingly, if providers use those same standards for composing an in-person visit while still being virtual, that can make all the difference. So it's really important to ensure that you're still building rapport, asking how their kids or their grandkids are, asking if they're still working at the same place and if they're enjoying it. And these are all things that are really a part of our social history taking skills anyways in a virtual encounter. So just really making sure that that still continues on virtually. It's also important that the entire staff have this same outlook and that they all send the same positive message. Patients pick up on social cues and they pick up on apprehension. So if a hesitant patient is convinced to do a virtual visit, has issues, and calls a nurse or a receptionist who isn't familiar with the process and kind of gives the patient the runaround, that really dampens their experience. or as I mentioned a moment ago, if everyone else in the care team is accepting and excited about telehealth, and the provider isn't, that discontinuity can really be felt from the patient's perspective. And this really all comes down to ensuring that staff are well trained, not only in how to use the process or the software normally, but also what to do when things go wrong and how to troubleshoot. In our respective educations, we're really taught how to facilitate patient interactions in person. And by the end of our training, we feel very comfortable doing that, but there isn't very much virtual training in a lot of clinical education. So it's really important that your team is all on the same page and that they're well trained, and so that everybody can handle any obstacles or anything that pop up in those instances.
Absolutely, completely agree with that. And I think that it's important that the providers are portray that positive approach, asking those really great questions while they're doing those sessions with the patients, and also being observant. If there's something around that may have, we have the advantage now where we might be in someone's home, and you can take advantage of that and be able to understand, what other factors might be at play for that patient in the visit.
Oh, absolutely. I've actually just read an article recently about how telehealth visits are helpful for allergists because they can kind of see in the home, see how clean the home is, see if there's pets, things like that. So I really agree.
Yep, pets, etc.
I'll let Cynthia continue on with insurance there.
Not quite yet,
I'm
Michelle.
sorry.
I wanted to talk about messaging multiple ways. I can't stress how important that is. I had one really fun clinic that just embraced telehealth, and they were enthusiastic about it. The mat that says, please stand, 6 feet back, from the front desk until the next person's ready, said, now, if you were using telehealth, you would already be seen by the provider by now. It was really cute. They had T-shirts, they had a screen on the wall that had those revolving messages that they included information about telehealth. So it was really fun. The patients really got a very positive message in a lot of ways. Now, most people aren't going to go do all that, but one thing we see a lot of are signs in the exam rooms, so that they can be reminded about telehealth, or maybe show how easy it is. Here's a screenshot, so that people can start getting familiar with it and comfortable with that idea. Brochures, make sure that you have plenty of brochures on hand to talk about the telehealth. Make it large font. Assume it's going to be an older patient or someone that doesn't have a lot of time to read and they just want the facts really quick. Make sure if you are serving an area that is maybe a large Spanish speaking population, for example, that you have the brochures in Spanish as well as in English. And then if you have a website, great place to put information up that, yes, we do virtual care and this is how we do it. It's very easy. Words like that can make a difference. Also, make sure you have a tip sheet. What to expect your first day of your first visit. It will include things like screenshots and here's how you log in, or maybe you'll just be sent a link that looks kind of like this. You just click on it, however you get into it. But also be sure to remember in your guide to say what is expected of the patient. Now, Michelle talked about a private space. Believe it or not, we're having to see consent forms now that says, I will not drive while I am talking on my telehealth visit. Things you don't think about. But then also talk about the angle of the screen. I've had doctors say, I never did see the patient. All I saw was the ceiling fan behind them, because they would hold it on their lap. So part of it is, to put it up where you can see the patient, so the patient can be seen by the camera. And then also things like, again, they don't always equate a telehealth visit with a clinic visit. If you go to a clinic, what do? You bring your meds, you bring your insurance cards, things like that. Maybe your blood pressure readings, if that's something you usually bring. And they don't always think that telehealth, you do the same thing. So be sure in your tip sheet to ask them for things like that. We had one poor gentleman who was very frustrated. He was a little nervous about using the technology anyway. And then when he hadn't thought about bringing his medications, and he was like, well, I don't know why I have to do this. You have it in the record. Well, you know, he had medications from another provider and just didn't think about the fact that he should have it at the same time. So anything you can let them know ahead, that gives them comfort, empowerment. Then they feel when they sit down, they can think about more about what they're talking to the provider about. And then also make sure, just as in a regular visit, you tell them to have your list of questions. Again, treat it like a regular visit and just make it an overall positive message to encourage them to use telehealth, because the ultimate goal is health equity here. And that's what we're trying to kind of work towards. Next slide.
Absolutely.
So as with anything related to healthcare, the patient experience with telehealth is influenced by health equity. And I hear this word used a lot, and it's not always used correctly. So I kind of wanted to give everyone a good metaphor to think about it. One that I've heard that I really enjoyed is you just kind of close your eyes and you think of a random group of like 10 people, or think about 10 people that you might walk past on the street. If we take those 10 people and I give them all a pair of size 11 shoes, everyone's equal in the fact that they all have a pair of shoes. But you know, not everybody wears a size 11 shoe. The shoe might be a little bit too big, some it might be too small. And if we're lucky, we might have one person that's actually a size 11 shoe. So equity is making sure that everyone's shoes fit properly. In healthcare and telehealth, it's a little more complex than just shoe size. We have patients who may be of low socioeconomic status and don't have access to broadband in their home. Or like Cynthia mentioned, maybe they don't have a private space. Maybe they share a room with 3 other people and don't have the desirable privacy for the visit. We're hopefully eliminating transportation barriers in the lens of health equity by omitting the need for patients to physically come to clinic. But don't forget about this one completely, because the lack of access or housing issues may require patients to travel to a place where they can utilize a reliable environment to support the visit, whether that's a library with internet access or a community health center. Education, language, and digital literacy all really overlap with each other within this lens as well. If your patients don't have high school or maybe even a college graduation, working Zoom or some of the other more sophisticated telehealth software programs can be really confusing. And I think since the start of the pandemic, we've all kind of, had our virtual faux pas, or we're worried about the dog barking during a visit or somebody ringing the doorbell. So sometimes it's not even just education, it's just life happens when you're on these calls and you have to navigate around them as best you can. So it's important that you, number one, teach the patients who may be lacking in those skills, the skills that they need, but then also just kind of understand and meet the patient where they're at. And then a kind of an opposing example, I've had my own personal experience where I've been in a telehealth visit and I was getting an order for a COVID test, and I could tell that the provider was flustered, they were rushed. I could hear a lot of clicking around in different windows. And for me as a patient, that was pretty frustrating. I didn't feel like the provider was engaged or attempting to make me feel comfortable. So that's really important to just be aware and actually devote your time to the patient, just like you would if you were sitting across from them in an exam room. And so ultimately, it's just very important to assess those gaps that your patients may be experiencing in health equity, even if you're just doing a telehealth visit, and make sure you're accommodating them to the level that they need to be, so that you're finding that quote unquote perfect fitting shoe.
I love that example, the perfect fitting shoe.
Yeah,
it's really great.
I really love that example too.
Yeah, I've seen some other examples of demonstrating health equity, but I love that one. I also wanted to point out that some people have said, well, telehealth should be equal to or better than. And I want to push back on that better than. Why do we have a different standard for telehealth? we should have a just as good a scenario ideally. But when we have a lack of access, because we do have a health equity inequity happening, then access trumps the system or the process being exactly the same as you would in-person visit. So I think that's important to bring out as an equity element. And I'm also going to add, if I can, the idea lots of folks are putting together digital literacy programs and health equity programs together, and they are utilizing their navigators, they're utilizing community health workers, and there are, and I'm sorry if I'm preempting slides, I don't want to do that, but there are some free services at your local telehealth resource centers that have free navigators or community health worker training in digital literacy and health equity to help you. And it's a good thing to partner with some of the senior centers and rural healthcare providers. They may already be doing some of this, so you can take advantage of it. Let me go to the next slide.
Yeah. So the goal is we want the patient to be comfortable as possible so they can think about the visit rather than about the technology. And so you need to, one of the things is to assess, again, as I mentioned earlier, have they used telehealth before? Was it a good experience? Because sometimes they've used it, and especially early on in COVID, there was a lot of bad experiences. So we need to find out, kind of assess where they at in their experiences. Also, what, as we've kind of mentioned, where are they going to be accessing the care? Is it going to be their own home? Sometimes they've had to go to family members' homes. Sometimes they've had to get in the car and go in a parking lot to access it because there was a better signal up the way. And so are they using internet? Are they using cellular? A good question that one clinic used is when they were talking to them, they were going to go over a computer, and they said, do you video stream? Because, you know, if you ask them what their bandwidth is, or their speed, they don't probably know. But if you can say, can you video stream? It's a pretty simple yes or no question. And so that kind of gives you some insight into what they have available to them. As Michelle just mentioned, utilize your community partners. Those are great. We had one particular one, it was a Latino community center that offered a lot of programs. And so we said, hey, you know, we noticed that you do some computer classes, you know, and so we were able to work with them and get them to kind of take it the extra step and work with them on it. They may be more interested in Pinterest or surfing the internet, but a lot of the same skills can be used in the telehealth visit, and it just makes them more comfortable. They know they're not going to break the computer if they try to use it for telehealth. And we had a mobile van that pulled outside a senior citizen center, and it was great. They went there for their senior lunches, and then they got to go to the van to do blood pressure checks and stuff. And that was an ideal time to also utilize them for digital literacy if the patient was going to have a telehealth visit later that week or the next week with their caregiver. And so you kind of grab at these opportune moments of interactions. And sometimes they, as I said, they had actual, like the Latino community had actual classes for that. But a lot of times they also have volunteers that are just willing to help them through this if they're comfortable already with technology, to help them with something new. Now, again, it was kind of mentioned, libraries and schools. What we're seeing is that more health systems, that I should regress. Not everybody has access to internet or cell service, or they have a pay phone that or a prepay, I guess, not pay phone, a prepay phone. And so a telehealth connection isn't good for them. They just can't do it. So we are seeing an increase in healthcare systems, or even medical schools that are trying to do outreach are partnering with libraries and schools to actually create a room with telehealth equipment in it. So the patient can go there for the actual visit, especially if this is like for a specialty visit or something like that. They can actually go to the room, and if they need assistance to make the connection, then someone at that school or library can help them make the connection and then leave, close the door, and the patient can have their visit. And that really has helped a lot. And it also helps kind of foster this sense of community between the healthcare system and the local communities when you reach out like that. And then, as Michelle mentioned, the community health workers or navigators. We had one community that had 14 languages. We couldn't do brochures in all 14 languages. So the community health workers is what that community had. And they were great. They could help reassure the patient. And we then, they could help them through the downloading the app and so forth. So I can't emphasize enough how wonderful it is to have those community resources to tap into sometime. And then on the training, you really want to train ahead, if at all possible. Again, with that community navigators, they did things like help download the app, as I mentioned, to make sure they got the right one. Sometimes there's more than one choice. You have to make sure you got the right one. And then went through the process of how to initiate the telehealth visit. And then if you can reassure them, the patient, that everything will be okay. But if they have a question, here's a phone number to call. So again, they feel like, a little more comfortable. Okay, all these little things keep making, kind of increase their comfort level. And one thing that we had to tell them is technology can happen. If you're using your phone for a telehealth visit and someone calls, it might, break the visit with your doctor. So what do? So you tell them, okay, go back to the link. I mean, if that's your workflow, go back to the link and reconnect. The doctor will see you in the waiting room and then go back and let you back in, or whatever you need to, whatever it's going to work. Tell them not to answer, if they're on the computer, don't answer that Twitter message or surf the internet while you're waiting for you're in the virtual waiting room. So again, letting them know ahead what to expect and maybe some what not to do helps increase their comfort level. Next.
Good points.
So everything we've talked about so far all sounds great in theory, but it doesn't mean anything if the visit can't be accessed or facilitated. And so there's a number of things that we can do beforehand. Cynthia mentioned some of them to ensure that all of those gaps in health equity, like the digital literacy and connection, are addressed. One thing that I really liked, and Cynthia really touched on this, is the idea of providing a tip sheet or a guide that can give specific step-by-step instructions on how to join the visit. To ensure that patients of any education level or digital literacy level are accommodated, starting the guide with the most basic steps, like opening the browser and typing in a specific URL, or like Cynthia had mentioned, making sure that they have the specific application and showing them how to click on that icon via their phone is really incredibly helpful if you can do that in person before the visit has even started. And then this example here to the left is great because it's colorful, it's visually appealing. There's not too much text, but it still tells the patient everything that they need to know. It also reminds them to ask any questions that they may have. We all know that when we're in an unfamiliar environment, we're more apt to forget things. So having a reminder to have patients ask their questions is fantastic. And this particular guide also has a reminder to ensure that they're clear on what they need to do next, whether they need to end the call immediately, or if they need to stay on the screen and speak to the nurse afterwards, or maybe the scheduler to ensure that they have a follow-up visit if needed.
And the telehealth resource centers, if they are great sources for samples, because not everybody, you may feel like, well, where do I get started on a tip sheet or a guide? And the telehealth resource centers usually have some very good guides that are free, and you can adapt them to what you need. And, one thing we didn't mention on the practicing ahead, if you can do a test connect with the patient, that would be great. We suggest the same time of day as the as their actual visit. If they're going to have a morning visit, then practice in the morning. If it's going to be in the afternoon, because things like lighting can change, your activity around you outside can change. The capacity of the network can be, there's a huge difference. A lot of people will comment about how they're doing great, and then about the time the school's out and the kids are hitting the internet for homework and video streaming, that then all of a sudden they don't have very good bandwidth. And so if you can kind of practice and know ahead things like that are going to happen, then you can kind of work around it. And then again, make sure they have that security blanket, is what I call it. And that's the number to call with questions. If they have any before or during, they're having trouble connecting or something. Yeah, I know I went through all this and it worked, but now I'm having trouble. How do I do this? And that's just, I call it a security blanket, but it's really very good that they have that information and have something that makes them a little more comfortable.
I really love this tip sheet too, that you have a little snippet over here on the left-hand side. I think one other one I would add is not just if the video call fails, but what if there's emergency on the other end? People often forget that if you're in the office, you would call 911, that would be no problem. So you think, well, I'll do that with the video call, but your 911 is not the same as where the patient is located. So you have to have a policy, a procedure for your providers to understand, if I have to call 911 for this patient and where they're located, how am I going to get that number and how am I going to access that quickly?
Good point.
Next slide.
Mhm.
So as we come to the end of our short time today, I just wanted to again emphasize some points that we've discussed. Number one being to make the telehealth experience as personal and positive as possible. We wouldn't be in healthcare if we didn't all value personal connection and making people feel heard when it comes to their health issues, and virtual care is certainly no exception to that. And if anything, we need to be more cognizant of it when we're in the virtual space. Creating a guide like we've just discussed in the previous slide that's specific to your organization or practice can omit confusing scenarios and give patients something to reference at home. In patients who don't have any experience with virtual visits, practicing how to access the system or software is a great way to bring them up to speed. And this can be done in person with the patient's own device if the care team knows the patient is planning on having virtual visits in the future. And ultimately, it's just very important that we never assume that the patient knows exactly what we're wanting of them, and to practice ahead of time to make sure that they're comfortable. We also want to make sure, as Cynthia mentioned, that they have a number to call if they run into issues or if they have questions. If the patient is having issues and they have to call the main line of the clinic or the hospital, they might catch one of those phone tree prompts where they have to push certain buttons to get directed to certain departments. And that really eats up precious moments of that virtual visit if they're already lagging behind, the start time of the visit. And so we can avoid this by just giving them a more direct line to be able to troubleshoot those problems right away. And finally, we want to make sure that the patient understands why telehealth is utilized. Was this just a one-time thing? When or where is their next follow-up? Is the follow-up even needed? Ultimately, continuity is just really crucial to having a successful patient experience with telehealth.
Important point there, that the patient understands why we did telehealth this time, right? Versus other times it could be a series, maybe we're going to do it on the third visit, etc. Anything to add to that, Cynthia?
No, I think that that's one of the things to always remember. She said the summary. And if you can send the summary in writing as well as in verbally, that sometimes people, how many times have we been to a doctor's office and we can't remember half of what they said? So we get a readout, right? And so make sure that, again, as we're trying to equate with an in-person in the clinic visit, try to make that available to them. And if you have a patient portal, it's easy, right? You can just put it in the patient portal. If they don't have a patient portal that they access, then you have to devise how to get that to them that they feel comfortable receiving it. It may be the mail. You know, it just depends on how you want to do that. So that would be the only other thing I would add. Again, as you can tell, there's all these things that we used to not have to think about when telehealth was in a facility. But now that it's in the home and increasing, what is it? It's about 20% of the video of the
Total
primary
visit.
care
Mhm.
visits are virtual.
Mhm.
Well, the whole vision of a hybrid approach to health is just going to grow. And so we need to think about this. And what is it? The FCC recently put on a webinar about that access to digital telehealth is now one of the, not digital telehealth, but digital is the digital divide is now a, now I'm blanking on it.
Standard of care probably is
Determinant,
something.
yeah, a social determinant, right?
Yeah, that's a good point. It is a social determinant of health. Yeah, if you don't have access to broadband, et cetera, it's becoming a utility, right?
Mhm.
And I know in some cases in rural areas, they're actually putting their cable service, shouldn't call it cable service, their internet service, I'm aging myself there, onto their electric bill. So it's just part of the other utilities that people have. And eventually it becomes a safety issue as well. So not able to access healthcare and other services via the internet. It's all rolled into one, just like any other utility. Thank you so much. Are there any questions from the audience and any other thoughts from Tiffany or Cynthia as we run to questions?
No, I think we've talked quite a bit.
It's important. So I don't see anything in the chat just yet, but you can put a question in the chat or in the Q&A. Either one works. If you have a question for Tiffany or Cynthia, this webinar was also recorded. As we mentioned, both of their email addresses are available on the slide in front of you. So you can always email them or contact us on our main line. I would also encourage you to follow us on LinkedIn, Twitter, and Facebook, or any one or all of three. We share a lot of information on those sites that includes important articles, interesting articles, other webinars. All of our webinars, our radio show, and anything that we provide is always free on our website. And we often advertise it in these vehicles as well. Tiffany, Cynthia, thank you so much for imparting your knowledge. You guys are great. We're smarter for you and for the time with you today. Thank you.
Thank you.
Thank you for having us.